Okay, I think we'll make a start. Thank you very much for joining us. This is the first webinar from the Mental Health Social Care Research Centre. We are a small group of researchers based in the School for Business and Society at the University of York. We are undertaking a range of projects, mostly funded by the NIHR. And we thought it was about time that we hosted our own webinar series where we talk a little bit more in depth about some of our work. I'll introduce today's in just a second, but first of all, some housekeeping. We are expecting about up to 50, 60 attendees. So we have set this up as a webinar format, but we can, or you can unmute, I think, when it comes to the discussion a bit later on. But if you've got questions or comments, then please do use the chat throughout. We're quite a friendly bunch, and it's nice to interact with you and have a bit of a chat as we're going along. As long as it's not too distracting for Ruth and Amy, we're happy to have the chat. If otherwise, if you can keep your microphone on mute, that'd be brilliant. We may mute some microphones if there's any noise coming through during the next hour. There will be time for discussion at the end, and we think it's important to have that Q&A discussion, comments, questions, and reflections time at the end, and we'll finish promptly by 1 o'clock. Just as a bit of an advert for future webinars, our next one is on the 2nd of June, when we're going to be focusing on some of our work with the Gypsy Roma traveller communities. And then our next one is in September after that, when we'll be reporting on the Community Navigator trial. Please do check out our website for updates for future webinars. Join our mailing list and subscribe for updates, as they say. Right, I think that's covered the housekeeping. Anything else, Nicola, I've missed off?
We do also have a webinar on the 14th of July.
Thanks for reminding me.
Yes. I think Ruth has covered in her final slide. She has a slide kind of noting what's coming up in forthcoming webinars.
There we go. Check out the website. It's better than my memory. So today we are really pleased to launch the Lonely Parents Hub. And this is based on work that's been conducted and led by Ruth, but in partnership with Amy, around parental loneliness. And I'm now going to hand over to Ruth and Amy to lead us for today's webinar. Thank you very much.
Thank you very much, Martin, for that introduction. It's really exciting to be here today, and I'm really overwhelmed by how many people are here, people that have been part of the journey and new faces as well. I'm Ruth. I work at the University of York in Martin's team and also in the family wellbeing team. And this project came about, I would say, about 4 years ago when I was just returning to work after a period of maternity leave. And it is about exactly 4 years, actually. And I came back and had a fire in my belly about parental loneliness, having experienced it myself. And by October of that year, the fellowship project, the original one, was funded. So it's quite incredible, really, the 4 years of research that's gone into this and the amazing networks and everyone that supported it along the way, which you'll hear more about. So the project was funded by the Three Schools Mental Health Programme. So it's important to mention them. And today we're launching the Lonely Parents Hub, which is really the accumulation of everything that we've done together for the past 4 years, myself and all the many people that have been involved. And we are aiming to provide evidence-based resources for parents, professionals, researchers and policymakers to really keep this conversation going. This project was really just about raising the profile, finding out and building a platform for the future of progressing research in this field. So Amy is a fantastic long-term lived experience collaborator who has having an increasingly larger role in the project as it's grown. And she is, co-presenting with me today. So would you like to introduce yourself as well, Amy?
Thank you, Ruth. And I was just going to say, it's been a massive privilege to be working with Ruth, which I've done since 2023. I was looking back. So I'm a lived experience practitioner with my own lived experience of perinatal mental illness. Excuse me. And yeah, I do work across the healthcare sector in NHS organisations and also increasingly in sort of research areas. And I bring my own lived experience, but also really passionate about not just bringing my experience, but facilitating that of other people as well. And I first got to know Ruth when I responded to her advert in the McPin Foundation newsletter to join her lived experience advisory group. And I was really struck by how well put together it was and how it sounded like a great project. And then it's kind of gone from there. And like Ruth said, I've had the great privilege being able to sort of collaborate more and more with her and seeing how this work's developed and really expanded and making an impact. So yeah, but I'll let Ruth carry on and tell you more about it. Thanks, Ruth.
Brilliant. Thank you, Amy. Yeah, and I think already, before we've got into the meat of the presentation, we've already picked up on some sort of themes that run throughout this presentation, which is the importance of lived experience and collaboration, which is really why I feel like the success of this project has come from valuing both of those. So yeah, what we're going to talk about today, we're going to talk about the background for those that are new to the project. I know we've got some people that have followed it along, so there might be some repetition for some people, but yeah, the background to the project. And then we're going to talk about how we developed the resources for the Lonely Parents Hub, which is really, really important to share. And then we'll talk about the actual resources themselves. So we'll give an overview of what's on the website and what's part of the Lonely Parents Hub and the key findings from the project. And then we'll have some questions. Yeah, and all of the illustrations here are designed by an illustrator, and they were facilitated by lots of people contributed to all of the illustrations and images you see here as well. So yeah, so I wanted to start by just a brief overview about what do we mean by perinatal loneliness. So perinatal covers pregnancy and the first 2 years after birth, although throughout this project I can sort of see a more an increasing argument for actually expanding this work for parents of 0 to 5s in the whole early years. When I first started, I used a narrower definition of perinatal, which was the 12 months after, but I think everything is moving towards that being 2 years after, which fits with the first 1,001 days critical period for children's outcomes as well. So loneliness is a subjective negative experience of a gap between your desired and actual sort of social contacts, meaningful emotional connections, or feelings of integration and belonging. The subjective part's really important here because that means that everyone wants different things, which explains why some people don't feel lonely, even though they don't have many social contacts because they don't need them. And other people feel really lonely, even though they have lots of social contacts, perhaps because they lack a meaningful emotional connection within them. So it's a very complex area and we could get deep into it. But just to alert you to, that is a key finding from the project, really, that we need to be thinking about loneliness across those 3 different domains, whether you've got lots of social contacts, whether you've got people to share your feelings with, and whether you feel like you belong somewhere. So findings from the study show that so the lack of social contacts we call social loneliness, and this affects parents who feel like they often live in a different time zone from friends and family and colleagues because they may be up all night or sleeping bits during the day, or they don't get to see people. Their friends and family are at work during the day. They find making new friends is hard in a time where they are looking after their baby. They have fewer social opportunities, maybe have had to give up hobbies or work, and they often say they feel physically alone and have few adult conversations. So social loneliness is really prevalent amongst parents. Emotional loneliness is also really prevalent. People feeling like they have no one to share their feelings with, and even where maybe they could share their feelings with some people, they might feel ashamed about how they feel about their baby, how they feel about their mental health. So actually it's they don't feel they have someone safe to share those hard feelings about parenting with. This also leads to masking difficulties as well. So parents won't admit they're lonely or ask for help. And also relationships change, relationships with friends, relationships with partner change a lot in the perinatal period, leading to feelings of emotional loneliness. And then sometimes, even when parents do reach out and say that I feel really lonely, people say, oh, that's just normal. And then they don't feel heard, they don't feel understood, they don't feel listened to. So that contributes to emotional loneliness. Finally, the existential loneliness that you can see on this slide. And yeah, this slide is in the report, so you can go read more about this as well. But that's really around feeling like different or separate from others, and yeah, lacking feelings of integration and belonging. And parents can feel this if they don't feel like they fit in their previous social circles anymore, or they lose their identity, or yeah, that liminal space between forming their new identity as a person and a parent. And also experiencing like discrimination as well can contribute to existential loneliness. So, next slide. So why is addressing loneliness important? So yeah, I mean, being lonely is a negative experience that has lasting consequences. And it has been pointed out in previous research that if loneliness is only like brief, then maybe it's not as bad as chronic loneliness, because obviously like the health impacts might accumulate more if you're lonely for a long time, and short periods of loneliness might not be as important it might be something you can move through easier. But considering like how important pregnancy in the first 2 years after birth are, and all the evidence around how important that period is, then it's really important to address perinatal loneliness, even if then parents move past that. So yeah, loneliness and perinatal mental illness are linked. And at the moment, 1 in 4 mothers experience perinatal mental illness in the UK, which is just shockingly high. It used to be 1 in 5, but the latest research was 1 in 4. Loneliness is linked with suicide. And suicide is the leading cause of maternal death after birth. And fathers are 7 times more likely to die by suicide than mothers during this period as well, which is a recent statistic. So anything we can do to help in this. So yeah, 82% of parents have felt lonely in a recent Homestart UK survey, with the highest rates among new parents. That survey was all parents, but new parents were the loneliest. And I work on a number of other projects as well that have kind of span out from this research. So I work on one looking at support for young mothers in the perinatal period, and one designing an intervention for Muslim mothers. And even though they weren't specifically about loneliness, it's incredible that when I go and do my fieldwork, loneliness just keeps coming up again and again. Like, I'm not like looking for it necessarily, but those groups of parents are saying that they're lonely. And recently, my partner joined a dad's group in Sheffield, and it's like this dad's WhatsApp community, and everyone on there was the guy that ran that group actually did a little video. Oh, we've got 500 dads in this group. Why I set it up is because I feel lonely. So it's as relevant now as when I did my research a few years ago. So yeah, I'm now going to pass you over to Amy to talk about like how we approached the project and the values-led approach that we used.
Yeah, thanks, Ruth. Yeah. So, before we kind of dive in any further, I really wanted to communicate why I believe that this work actually works. Why does it work? And this actually came out of a conversation that Ruth and I had a while ago when we were preparing for a different webinar. And we were kind of discussing why we were both so passionate about the project. And we know that it both came out of our own lived experience of perinatal loneliness. So it was very personal. But it also, because of that, it meant that we were really empathetic with other people, and we've kind of determined to make a difference to those individuals and families, and of course, like the wider society. And I think that it made like kind of the values behind the work really kind of clear. So yeah, I'll just go through this. Like, we made a commitment to impact. So if you like no one should really be interested in research just for research's sake. We don't want to spend time, energy, and finance for a research paper that's just going to sit on a shelf as an academic exercise. And you could really argue that's unethical to put that amount of work into something that's not actually going to make a difference. And I think from the beginning, Ruth's really seen like this need to address loneliness, and that's really driven the project with so much passion to see change. And the partnerships have been built from the beginning. So when I first joined the lived experience group in 23, it really struck me that Ruth had been already building a huge network of organisations and communities to work with, even before she'd decided on a research title. We were involved like right from the start. So, with engaging parents, professionals, and communities in an authentic way to collectively develop the shared solutions. Ruth's approach is not a tick box exercise, which can be the case in some research projects that I've been involved with, and others might have done too, where there's a sort of we've got to engage with the public and patients, and to sort of tick that box and prove to funders that you've done that. But that's definitely not what Ruth's been doing. She's built relationships with many different groups right from the beginning, and kind of almost before the beginning, if you like. And those relationships have really evolved. And through that, she's been identified particular groups or focuses on the subject of loneliness, which couldn't really have happened without really engaging with people. As we said, it's begun with an embedded, diverse lived experience. I would say, every stage of the work, we've been really amazed at the richness of the conversations that have come out of the different groups. And it's been, genuinely, there's been a huge diversity of backgrounds and experiences. You can see from Caroline's fabulous drawings that she's tried to really capture that diversity. And everyone's contribution is equally important. In the research language, that's called epistemic justice. And it's something that doesn't always happen in healthcare and research, and especially when working with people with experience, because sometimes we're seen as less professional. But there's a huge array of skills and insight and other professional experience that lived experience people often bring, and that is just totally invaluable. And we're all bringing different things. And some people bring a lot and do extra work, and some people do the minimum, and it's all really valuable, and there's no pressure to kind of do more or less. The last point about the authentic relationships, which are really ongoing and they continue after the initial research finishes, and that speaks for itself, really. All the other things I've talked about have meant that people who've been involved have felt that their communities have been stronger, and sort of the project itself has been about addressing loneliness, but people have said through doing the projects they felt less lonely because they found other people who've experienced similar things to themselves. So in a way, the project is solving part of the problem itself, which is lovely, and that's a message that we've picked up time and time again. And then, for the impact, some projects go along and then they say, how are we going to disseminate? Who are we going to disseminate this knowledge that we've picked up to? But through this project, Ruth and the teams have built up so many contacts that when it comes to disseminating that, there's already communities. I've taken these things to friends and said, look at this, that's great, and other groups, and it's something that people can pick up and read. So the impact is already happening, and it's going to happen a lot more as we'll see. So I just wanted to say as well, it's worth considering if you're doing any projects of your own or involved with things, to kind of step back and consider what values are kind of behind what you're doing and might inspire you, so that you can kind of stay authentic to these. And just say, you know, the whole point about building the communities and relationships pays off so much. You really reap the rewards of that, and it's such a joy to be involved with lots of people and get to know them. So I'll pass on to Ruth again now.
Well, thanks so much, Amy. That was a lovely overview of our values-led approach. But yeah, it's absolutely right what you were saying about what everyone brings. People have brought so much, and we've been amazed at how much people want to give to this project. And I think that is because as well, people feel like the shared ownership of it. So yeah, what contributed to the resources that we're going to present today? So it was a 3-stage process I kind of worked out. So there was kind of like an incubation period that was sort of the previous research, Adlington, Taylor, Levy, Nolan, and Kent Marvick, Jackie, you're here today, who did some scoping reviews, metasynthesis of qualitative literature, very much sort of started. Yeah, when I went to Google like perinatal loneliness, I was like, this is what came up and where I started. And then I had my own lived experience, but I saw lots of other lived experience from LGBTQ plus communities, fathers, and like lots of organisations on board to develop the research proposal. So that was the incubation. And then there was a qualitative study and a scoping literature review. And then I brought in more PPI and partner perspectives. And then, in the research phase, we then developed a video and an easy read report. And then finally, there was an impact phase, which was further PPI, and then we developed a policy brief, booklets, and a website. So yeah, the incubation was probably like April 2022 to October 22. The research was October 22. So yeah, I can't even remember when that finished, sometime in 24. And then finally we had this last bit of impact funding, which funded this loneliness hub for the impact phase, which has just finished last month. So I won't go too much into this, but you can see, basically, so the main funder of this project was the fellowship that I had, and then an impact accelerator grant, and there was other Festival of Social Sciences. But yeah, lots of interviews, focus groups, a review of 50 interventions for loneliness, 23 lived experience partners, 22 practitioners who contributed to advisory groups, and then a whole group of 19 people that contributed to a research and practice group joint paper as well. But yeah, and then the banner at the bottom is the Perinatal Loneliness Project. And yeah, these are all the organisations that contributed to the resources. As you can see, there's a lot there. So we've got here today Nikki Pierce from the University of Lincoln, who helped with some impact work, as well as Anna Tarrant and Manuela Barreto at the University of Exeter, Stephanie Tierney at the University of Oxford. There's lots more people. It's hard, I can't name everyone, but as you can see, there was a lot, and this has made the project so much richer and made sure that we get lots of diverse experiences. So the key outputs we developed from the project were a video sharing parents' experiences of loneliness, and this was with the sort of aim that if parents watched it, they might feel a bit less lonely, just sort of watching the video and seeing, and also for to be used in teaching as well and sharing with professionals and practitioners. We'll share a little clip of that, but very brief because it's like about 7 minutes, but so we can't share it all today, but you can watch that. We also, together with a colleague, Rebecca Nowland, we've developed a theory of perinatal loneliness, sort of to be used to understand like why loneliness arises and how we might address it. We've also produced recommendations for parents to help them overcome feelings of loneliness, and practitioner services and groups to support parents and policymakers as well to operate at the policy level. We've had a series of research and practice network and online conferences. There's been 2 so far, and there is a network that you can join. We also developed priorities for future research in a consensus statement paper, which is published in the BMJ Open. and that was with the research and practice group. And then finally, the website for sharing resources and building a community, which is the Lonely Parents Hub, which forms the community now. We've moved from moving from the research stage and the branding around this sort of perinatal loneliness project to actually the impact phase, which is the loneliness hub. Amazing. So before we go into talking about the resources, and that'll be an overview, Amy, do you want to just talk about the process of developing the resources and how we did it?
Yeah, so again, out of the project, it was great that Ruth was given this accelerator grant to actually, as I say, make research come off the page and into reality. So Ruth asked me to kind of recruit some lived experience people to form a group, and she also took this to some of the other groups that she'd been working with. So I recruited from people who'd been previously involved and also sort of other people that I knew. We only had the opportunity to have one full-on meeting, so I did contact people that I already knew, so that we didn't have to kind of build relationships, so that we can kind of hit the road running with it. But we had some people with great experience and a lot of diversity in that. So this point about openness again, so we were wanting to share the findings of what had come up from the solutions to perinatal loneliness, and bring that to people and say, these are the priorities that came up, but also to say, what else do you think, looking at it fresh, what needs are there? And again, the resources was driven by the data that we had. It wasn't plucking things out of the air that hadn't already been, established. And the point was about trying to make something really impactful, so that those priorities could be met. Just to add to that, that the psychological safety of the group was really important, actually, to making to making things work. When people were there, they already knew each other and were able to very quickly share their experiences and their thoughts without worry. And I think that's it's always key, isn't it, when you're setting up groups, to concentrate to focus on making sure that the relationships are good. And that comes into this point about bravery, and I would say that's bravery from our side and also from the participants' point of view. So the bravery is, coming and saying, we've done this thing, it's not a closed book, please just say whatever you think, don't be afraid to say that. And also that having kind of humility to say, we've done this, but we don't always get it right, tell us what you think, because that way we're going to get the best output. So they were quite honest, and they said, I think the leaflets, the draft ones, they're a bit too researchy, they're a bit wordy. I wouldn't really pick it up. They just wanted something to say, are you lonely? And here's the information, rather than this is all the information about the research we've done, which you can find somewhere else. And so this really led to a sort of overwhelmingly positive amount of feedback. And even after the meeting, people were sending in emails, I've thought of this, I've thought of that, and the input was just huge. And I think that point about the humility is really good, because when you're saying, we're not quite sure, or we're just on a process, it invites people to actually bring their skills and their gifts, rather than think, this is the researcher and we're just the group. And that helps people develop their confidence. So saying, Ruth, somebody's helped me develop my confidence, to kind of grow in my research journey too. And that's because she kind of let us explore, really, and was always happy to hear what we had to say, and pick up on things, and so the feedback thing about multiple cycles was, but people kept coming back with more ideas, and there were some lovely kind of fortunes, if you like, in that, you know, one of the lived experience group happened, if you like, to as well as having her lived experience, she's an experienced website designer, so she's been able to sort of collaborate more on that side of it, and you know, look at the website and say, well, actually this would work better. And I can see that from my lived experience, but also my professional experience. And then another person who I've seen is here today, was loves drawing. And you can see in the bottom left-hand corner, she did these lovely illustrations, and then was able to work with the designer to you know, to fit in with the brand. And so we've had people's, not just their lived experience, but their other skills come along into that feedback. And then, yeah, time and patience. So if we just produce something and said, what do you think? And then a few comments, then perhaps the leaflets would all be ready by now. But but there's been so much, you know, Ruth was like, oh my goodness, I've got all this feedback from this group and other groups. And so it's taken a long time to actually put that together and really think carefully and thoughtfully about it, and not just do something quick that, you know, that will do. And I think, you know, what comes out of this, the final kind of product will be something that people can see themselves in, because it's had such a lot of lived experience input. So it's worth it, that patience, really. And yeah, consequently delays, but delays for such a good reason. And I've thoroughly enjoyed doing this lived experience group here. And although I've done so much co-production, every time you're surprised by just how much input that comes your way. So yeah, really great. So it's going to be great to see the final product eventually. Right, Ruth, thanks.
Thanks so much, Amy. Yeah, and yeah, there has definitely been a few delays with this project. Yeah, mainly because when I email so many people, and I don't expect every one of them to send me such amazing feedback, but it has actually, yeah, it's been really worth it. I don't think I would change what I do in future. I just think I would allow more time, because yeah, if you sort of expect people not to give you it, but the initial leaflet design that I had, or like, actually it wasn't a leaflet, it was just a booklet, and actually they wanted a website, they wanted a leaflet and a poster and all the amazing ideas, and I just like went with it. So it did change quite a lot. Okay, so I actually think that we're not going to show the video. Yeah, we'll show one clip from the video because we are running out of time, even though yeah, I hope that won't happen, but yeah, it's hard, isn't it? So we'll just show one clip, but this is all available on the Lonely Parents Hub YouTube channel. And these are stories that were gathered. So yeah, from the qualitative research that I did, the interviews and focus groups with parents, we sort of synthesized them into stories that represented 9 different characters' experiences. Yeah, and I will just show you a couple now. I think hopefully the sound will work. No, the sound isn't working. Okay, that's fine. I've just got a new computer and I might not have got the settings right, but you can sort of see what the videos are anyway, and they've subtitled and things. But yeah, that's the vibe. So yeah, that's the video, and they're all available as shorts as well, so you don't have to show people the whole video. You can actually just take out the dad stories, or the stories that might mean something for the people you support. So yeah, one of the things that myself and Rebecca Nowland are working on, and this is hopefully will be coming in a paper that we'll publish soon, but is just like around a model. And this is for the researchers in the room, but also everyone thinking about designing support for parents, but a model of what contributes to loneliness. And this is the socio-ecological model of loneliness, which considers all different factors at different levels, from the individual to the societal, about what contributes. And this really fits with the research, and also the published research, and also our qualitative research. So yeah, Rebecca Nowland is a long-standing colleague who's supported this project enormously. So yeah, very briefly, and the paper will be out hopefully soon. We recognise that lots of individual factors contribute to loneliness, like your age, health, the number of children you have, whether you have adverse childhood experiences. These examples are by no means comprehensive, by the way, just to keep it brief. So the next sort of domain is meaningful relationships, and that is with partner, family and friends. And it's like, yeah, not just the amount you have, but the quality of them. The next is around the availability of resources. So by that, it's what is actually available in your area in terms of health and care services and infrastructure, green spaces, transport, like what can you actually access in your local area? The next is around integration and belonging, and that's how do you feel in the places that you are part of? So how do you feel in your workplace? Do you feel like you belong? How do you feel in your local health and social care services? How do you feel? Do you feel like you belong in your local baby groups? And then finally, sort of the societal context, which is huge around, and things that contribute to loneliness in that domain are things like limited parental leave, poor investment in public health. I saw today health visitor numbers have dropped by 20% in the past 5 years. Again, like they keep dropping. Investment in early years services is dropping. Lack of childcare provision, so parents can't get a break. Housing and transport. So that is one thing. So a lot of the resources we've developed speak to one of these domains. So in terms of the societal factors, the policy recommendations really speak to that. And there's we've launched this week a policy brief with the National Children's Bureau, who contributed to this. You can read the brief. It's online and on the website. But we are recommending that we integrate routine identification of loneliness and perinatal mental health into all universal services like midwifery. This is going to feed into an initiative where there's a bill at the moment where like have a dedicated mental health appointment antenatally. So actually an appointment that's just about exploring things like mental health and loneliness, to pick it up really soon. The other thing that we recommend is, sustained long-term investment in the early intervention ecosystem in the first 1,001 days. So supporting health visiting, midwifery, family hubs and voluntary sector services, but making sure that funding is for a long time, because it's really damaging when services are funded and then defunded, and all those relationships are broken. So support the parental leave arrangements through the ongoing parental leave review. There's a lot of work being done around this at the moment, and one of the findings from my qualitative interviews was that I asked parents, like, what is the one thing that would have made a difference? And by far the most common example was better, more paternity leave, because actually I know it's not for everyone. Some people are solo parents and they don't have that, and definitely, for some people that are experiencing domestic violence or abuse at home, it's not the answer for them, but it would be something that could be done. And also it's fantastic for parent-infant relationships and bonding and dad's mental health, so it's something that is really important. And if rather than just playing tag team like constantly, like if you're both at home, you can do more family stuff together. The other thing is expanding inclusive, specialist and mainstream support for fathers and non-birthing parents. Some of the law recently has been changed around IVF support for LGBTQ plus families wanting to go through fertility to have a child. This is going to lead to more babies being birthed that way. And there aren't that many specialist services for LGBTQ plus families who are identified at a greater risk of feeling lonely and often need that sort of specialist support. And fathers, it's the same. There's a whole list of quotes that I have that are dads describing themselves as things like spare part, third wheel, mushroom in the dark, like not feeling like part of the support, and the support's not available to them. So we really need to support fathers and non-birthing parents. And also to fund and deliver support specifically designed to reduce loneliness. Like parents are saying that isolation and loneliness are a huge factor in their negative experiences and contribute to their mental illness. But so often services are not designed specifically for that, and they actually want groups that are all about them, and things like craft and art and walking groups, and actually groups that are overtly about social connection. So that is the policy brief, which you can read more. So we've also got a report, like an easy read report that's composed of mind maps, which is the recommendations for services and professionals, which I have talked about a lot before. So I'll keep it brief here and just say you can go and read this report to find out more about types of loneliness, risk factors, what parents want from services and support. And then there's 2 dedicated mind maps for what fathers and LGBTQ+ parents want as well. So just this is an example of what it looks like inside the report. Each slide is, had a lot of work gone into it. Lots of people commenting, and they're on all those different themes. But what parents like, what would support social connection? So this goes back to, if you're going back to this model, it's around the integration and belonging, and the availability of local resources section. But services want, lots of what makes a good parent and baby group. People love a cup of tea. They like to feel like taken care of. They like inclusive language and imagery. Some people want separate safe spaces. Some people want digital spaces. But if you're looking for ideas, they're all in that report. We also have a research and practice network, which I have neglected a little bit actually over the past year or 2. Lots of other stuff going on, but this Lonely Parents Hub marks like the relaunch of that. And we have now set up the mailing list, and there's going to be newsletters. So there was a biannual conference, so we're hoping to hold one either the end of this year or next year online. And through that research and practice network, we identified future research priorities, which included identifying national prevalence is important, tracking long-term impacts for different populations, exploring the needs of different groups, and co-designing and evaluating support services. So we have also the resources for parents. So this actually came directly from Amy, actually, because when we did the video, which was all focusing sort of like what leads to loneliness, and was sharing quite a lot of our like hard to hear data about people's difficult experiences. And Amy said to me at the time, like, "Oh, it would be really nice to be like her, but what would the world look like if that would be a nice resource as well, like if you improved things." So that sort of inspired my wish to create something that could provide like a more positive resource for parents, coming from the data about like what parents wanted. And this is going to be like a booklet which will be available to download online. It is quite delayed because it's gone through so many iterations, as we've talked about. But what there's going to be is there's going to be a booklet that you can access online, but there's also going to be flyers that people can hand out, and there's also posters that can be printed out and displayed in like healthcare services, baby groups, schools, like lots of different places. And they will also be locally tailored, so you can download off the website a version of the poster where you can put a QR code to the Lonely Parents Hub, but also to the local support directory for your area or service or whatever you want to put on there. So we felt that was really important, rather than if you're going to put a poster up and a parent wants to do the QR code, take them straight to what they can access in the local area, as well as the resources. So the content in these booklets is information about loneliness, accessing support, and a series of practical advice and tips by parents, for parents. And I've mentioned about the flyers. So the flyers are currently and booklets are under their final round of redesign. So you can see this is what Caroline, the designer, is working with at the moment, with the big boxes of the feedback. But someone pointed out that the word infant isn't really, parents of infants under 5 or whatever is not like a very friendly term. So just always really helpful. I always think that I'm all right at being inclusive, but then I'm always humbled when I send my stuff out for feedback. So and then to finish, I think it is important to talk about the impacts. So the project was included for an NIHR case study around impact, Obviously, it's quite a small project. Like it might not sound like it from everything we've done, but it was quite a small project relatively. And yeah, we have a long way to go before we're creating the impacts that we want on this journey. But what we've managed to do is is quite, I'm proud of it. I think we all are that have contributed to this project. So already based on some of the findings, some groups have contacted me saying that they've changed like leaflets to be more inclusive. So one of the findings from the project is that dads or LGBTQ plus parents might not know that a service was for them if it just said the word parents. They just think that means mums. So actually people were finding that it's that just including LGBTQ plus parents are welcome here was actually really helpful. So we've heard of professionals changing practice in that way, just like a small thing that makes a big difference. Some new services have been developed as well, such as walking groups. I know that the research has been used in teaching, and the video is a teaching resource. And professionals have said that they think about loneliness differently as well, not just in terms of do you have any friends, but also interrogating the quality of those relationships. All of the resources are available on the website, which is lonelyparents.org. Just to mention Fork Studio, who designed the website, and Boy Oh Boy, Caroline, who did the illustrations and the brand. At the moment, the website doesn't look exactly like this. Again, still in the transition phase, but it looks pretty much like this. Just a few colours will change. And on the website, you have join the hub, the newsletter, all of the blog entries, all of the resources, and join the mailing list as well for updates for what we've been up to. So it's my colleague and I, Nabiha, presenting some research at a conference. When I was invited to Westminster to talk about loneliness, that was amazing. And there's some field work and Guardian articles. There's all sorts of interesting stuff on there. So I will finish there. Thank you everyone for coming. It's been fantastic to share. I'm so excited that we finally launched this Lonely Parents Hub. It's been a lot of hard work and love actually poured into this, and it is just the beginning. Just to mention as well, the forthcoming webinars for the Mental Health Social Care Research Centre and all of our work. I think if you come to the webinars, you'll see it's similarly informed by the values of co-production. Amazing.